Good afternoon. It's hard to speak exactly after lunch to wake everybody up, but I hope that my speech will not bring you to the dream, and we will have a chance to discuss a little bit about the perspective of the public health system in Ukraine and what happened in our country within the health care reform in general, how it will be bring to the health cities, and what is the public health in the broader context of European framework. So I would like to start maybe among the some challenges which was defined by WHO regional office several times and addressed through the several documents, which include the inequalities and economic crisis which country face, the globalization, migration, and urbanization, which impact the health of population on individual and community level. Aging of population is one of the current trends exist in every country, despite the big discrepancies in the life expectancy, which I will show you. And at the same time, the environmental degradation and climate change are one of the most hot topic in the discussion of the politicians and public health experts. This climate, all these determinants lead to the emergencies which affect the public health system, and simultaneously this emergency followed by the increasing role of non-communicable disease due to the lifestyle behavior and emerging and re-emerging infection disease. So when we look at the life expectancy data groups, there is like two issues I would like to focus you on. The first one is that the expectancy is growing starting from 1950 till 2050, and that means that aging is becoming more important topic to be addressed through the healthcare. At the same time, when we look at the specific areas, the different countries will achieve specific lives at different stage. And these discrepancies is in life expectancy within the European region is one of the main issue to be addressed through the public health. To summarize all factors which impact the health of population, I would like to maybe remind such documents, such graphs, which include that our health under the influence of environmental and social and economic determinants. And this include the issue regarding the heat waves, fires, droughts, chemical spills, and also the food security, which cause to the changes in the infection diseases habitat. When we talk about the social and economic determinants, in addition to aging and inequalities, we should remember about the technologies which from one side improve the quality of life, from another side could affect our lifestyle and also impact the health status. At the same time, these two major health outcomes, which is now addressed by the WHO regional office and by Ministry of Health, is the life expectancy and increasing prevalence of non-communicable disease exactly caused by this lifestyle. At the same time, there is a huge implication on the health system in general, which is related to increased cost of the treatment and increased demand for the treatment because of first of all, improving diagnostic technologies, and also because of increasing the age of the population. At the same time, every country, including Ukraine, observed the decrease in the workforces, which shorten the ability of system to provide care. That's why the public health issue is quite important, because it's based on the solution which includes the risk and projections, the research which prove our theory, and also some innovative solution through the implementation simple and easy to use technology at home or in the primary health care. When we talk about the evolution of public health system in Ukraine, in modern Ukraine, because the former Soviet Union has their own system which was mainly focused on the protection of the role of the government and state rather than the person and individuals. It started in 2014 when the government decided to reorganize former SAS, which was responsible for such an activities. In 2014 and 15, during this transformation period, a lot of assessment was conducted together with WHO, ECDC, European Commission, CDC Atlanta, and USAID support. And working group in the Ministry of Health was established, which started to develop the new concept of public health. This concept was endorsed by the government in November 2016, which is give a start for the transformation of public health system. At this time, also the formally public health center was established and core personnel was hired to the public health center. In 2018, we started some technical work, which include the appointment of new leadership to the public health center. Three institutions merged now, and 2 institutions are merging. We revised the center by law and organizational charter, and also conducted the strategic planning session. At the same time, the public health center worked on the new public health law, which is now submitted to the cabinet. Within a lot of public health areas, we defined eight priorities where the public health center is now working, which include improving surveillance, introduction of new principles to the health education, improving research capacity of the center, emergency and preparedness plan for the whole country, starting with the prevention program funded by the government, revision of the lab network for public health, starting with the new communication principle and health promotion and blood safety, which is now becomes the responsibility of public health center. At the same time, there was like 5 gaps, which include the inefficient national policy, which requires significant changes, and we applied for the technical assistance to our international partners and hope we'll got it soon, especially through the European Commission project, which are coming next year. The human resources, which is at this stage also aged. The average age of the person in the public health center at the beginning of this year was over 60 years old. And we need like a new wave, new generation who could come and interesting in the public health. Revision of legislation, which is outdated, and we terminated about 26 orders and regulation which exist from 1920 and regulated some public health aspects already this year. Finance and budgeting, because the new approaches on the procurement of these services is very necessary and in line with the broader health reform. And also as I mentioned before, the poor communication with the population and health professionals. There was like 6 objectives which exist for the public health center till 2020. Among them, the endorsement of new public health law instead of 42 laws, codes, and the regulation exist, and they sometimes contradict each other. The support of to the regional public health center network, which is now starting to develop. They introduce the new surveillance framework, not only for infection disease, but also for non-communicable disease. specific NCD action plan, which include improving the physical activities, healthy nutrition, fighting with the high blood pressure and cardiovascular risk, and some other activities. The public health network strategy revision. At this stage, we operate with the inefficient more than 800 public health laboratories. And the workload of these laboratories measured between 3 till 51% maximum. And also to establish the 24/7 preparedness unit to address the emergency to the population. Out of them, there is like 6 internal objectives, which are now aimed on the introduction new management standards, improve safety procedure and standard operation procedure for laboratories, launch the staff development plan, fix financial management, improve IT knowledge and skills of the staff, and improve internal communication, which was initially not exist at all. So at this stage, some kind of the achievement for 2018, we are now applied to the cabinet with the amendment to budget program on 1420 and 1040, which aimed at the financial projection for 2019 budget. This will give us the possibility to procure public health services in the different stakeholders, not only the state actors, including NGOs starting from 2019. This was happened because the amendment was done to the budget code in 2017, and despite this amendment will become mandatory from the 1st January 2020, some changes will be applied in 2019. At the same time, government in general, starting with the multi-year planning and budgeting, which help us to solve issue with the such programs like vaccination, HIV and tuberculosis. The law on public health is already drafted, passed through the public hearing discussion with the regions, and now submitted to the government, to the cabinet for their approval. If this, we suppose that during September, October, we pass through the whole bureaucratic issue and enter the parliament with the new law. We'll launch the field epidemiology training programs, which is the first innovative training programs for epidemiologists in the country, and hired the first cohort, which consists of 16 epidemiologists. And master curriculum framework was recently approved by Ministry of Education and Science. At this stage, network of the public health center exists in the 6 regions, where the National Public Health Center invests 6.2 million Ukrainian hryvnias, and our plans to establish this public health center in 3 years, which will cover the whole 25 regions of Ukraine. When we talk about the legislation and regulations, there is at least any progress which exists. We are very proud about the several strategy we suggested to the government, include the immunization strategy, hepatitis elimination strategy, national AMR action plan, and blood safety strategy. Instead of having the 3 to 5 years programming, we are talking about the 10-year strategy, which will divide it in the 3 years budgeting process. In terms of the national surveillance strategy, the strategy itself and action plan has been drafted. We revised the list of the notifiable disease, decreasing them from 157 till 57, about three times, and suggested decentralized surveillance model, which was approved by the steering committee of the Ministry of Health. And there was like a long discussion regarding changes in the lab network. Instead of having 800 across the country, we agreed to have a 25 regional lab center and 4 national one, which will be located in Kiev, Kharkiv, Odessa, and Lviv. To do that, we passed through the VISN model to evaluate and assess necessary staff for the network. We do have a lot of partners, which I would like to thank everybody for the technical assistance and support provided to the Public Health Center. And our logo become like a time to choose health. That's welcome to Public Health Center website, and thank you for your support.